14 years, Process Safety and Reliable Group, in collaboration with Richardson Oil and Gas Limited, has set the pace in Nigeria's socio-economic transformation through its annual HSSE Forum. The 15th edition, hosted at Eco Hotel and Suites in Lagos, took a different perspective with a focus on promoting mental health in Nigeria, a national agenda. In his opening remarks, Mr. Akin Osuntoki, the CEO, Richardson Oil and Gas Limited, highlighted goals of the annual forum and the essence of the conference theme.
The vision of the PSRG-Richardson HSSE Forum is to build an organization that creates, acquires, interprets, transfers, and retains knowledge. And of course, we channel such towards creating distinguishing values for our various stakeholders. Quickly, let me share with you the objectives of the forum. The key objectives are to bridge the knowledge and human capital gap that exists in the Gulf of Guinea and the practice of HSSE. We like to do research and development. We like to establish a global entity ready to explore and exploit opportunities in Africa and the Middle East regions. Also, we like to transfer skills and competencies useful in upgrading structures and internal business processes of clients. The goals, very quickly. One of the goals is to brainstorm, generate new ideas, and stimulate creative thinking. Also, we have the opportunity to give feedback to regulatory entities. We have treated various topics in the last 15 years. If you do a reality check, you will find that the issues of mental health are usually not discussed in the open. There is a culture of silence. Everybody keeps quiet about it. Nobody wants to mention it. And about 30%, 25 to 30% of Nigerians suffer in one form or the other. Only about 10% of this population have access to professional assistance. Depression has become like malaria. People, for one reason or the other, are facing one issue or the other that affects their mental health. Suicides, we read in the papers every day, people jumping into the lagoon. Laws on mental health needs to be updated. We need more resources for it. Families are fractured, broken, and indeed, the family support we used to have is no longer there. Drug and substance abuse has become prevalent. That, to me, is one of the reasons why we are looking at mental health today. It is no longer their business. It is now our business. Let's rise to the occasion. This is a clarion call to duty.
Partners of the summit, the Nigerian Liquefied Natural Gas Company, NLNG, Chevron Nigeria Limited, and First Bank Nigeria, commended the forum for bringing the spotlight on mental health in Nigeria.
We in Nigeria LNG are delighted that a forum like this provides a platform to share our oil and gas industry challenges and experiences, especially where it concerns management of mental health, and prefer workable ideas, sustainable solutions to issues related to management of mental health and other commonalities. We believe this HSSE forum will generate ideas that will provide innovations, strategies that will sustain our HSSE Goal Zero objectives in our sector.
On behalf of the board, management, and staff of First Bank, I felicitate with the leadership of Richardson Oil and Gas Limited on this remarkable occasion of the 15th edition of the Health, Safety, Security, and Environment HSSE Forum, and I welcome all participants. We at First Bank are honored to be associated with the noble cause of the PSRG-Richardson HSSE Forum, represent, which include prioritizing issues of health, safety, environment through strategic alliances and offering world-class value-added services and solutions to all partners and stakeholders. Your dedication, sir, to this cause year after year is highly commendable, and I appreciate all stakeholders for their involvement and support at all levels.
I commend the organizers for providing a forum like this for us to offer some thoughts and exchange ideas on this particular topic, promoting mental health in Nigeria, a national agenda. This forum represents a unique opportunity for stakeholders to meet, to discuss, and to analyze health, safety, security, and environmental issues in Nigeria, and relate these with international best practices. It serves as a platform to share challenges and provide workable solutions to issues related to HSSE.
The keynote speaker, Professor Olayinka Omigbodun, the Provost, College of Medicine, University of Ibadan, stressed the need for Nigeria to prioritize mental health and wealth, which is critical to economic development.
Our nation's wealth is powered by our collective mental health. Even more so, our nation's wealth is determined by our mental health, our mental wealth, the mental assets, that is the brain capital of those who lead and set the agenda. Our mental wealth provides a holistic measure of our national prosperity. These are some of the reasons why it's so important to have a mental health national agenda. And the mental wealth is underpinned by a nation's collective mental assets. The mental health of everyone in this room, the mental health of all those who work in the Richardson group would determine the output of those companies. And of course, it starts with those who set the agenda. And this is why we really need to understand mental health, mental wealth in setting our agendas. And it's influenced by a range of health, social, economic, and environmental factors, one of which is climate change. One thing is that great nations have structures and systems in place to promote the mental health of their population. What's a great nation? What's mental health? And well, when we talk about a nation, Nigeria is a nation. We may not meet the full, but we are a large body of people, over 200 million people, trying to live together, very, very diverse, different languages, different cultures, different beliefs, different directions, different religions, different thoughts and attitudes, but we have been put together many, many years ago by our colonial masters, and we have to find a way of living together. We are supposed to have a conscience of unity. I don't know if we have that here. I noticed that on my relating with people, that people are more ethnic conscious than nation conscious. I think that's something we need to be aware of. It's very, very different from other nations of nations. You take the United States of America, and people feel very much a sense of patriotism. But that, I think, is something that maybe would come with as our mental wealth and mental health develop. Great nations should enable their citizens to actualize. What is self-actualization? It starts with meeting the basic needs of food, shelter, warmth. If you don't have those, there's no way you can be secure and safe. And if you don't have the basic needs of water, electricity, supply, good transportation, there's no way you're going to really relax and enjoy intimacy and friendship. And then your self-esteem would have problems. And if you don't have an environment available to you to reflect, to think, to create, there's no way you're going to self-actualize. Great nations provide an environment for self-actualization. Great nations enable their citizens self-actualize. It's the self-actualization that brings forth creativity, innovation, and discoveries. A nation that has to import matchsticks and or export crude oil and import the refined products has a problem of self-actualization and mental health.
She emphasized the need for the government to fully implement the National Mental Health Action Plan.
Our government has signed that they will put resources together to ensure mental health of whole population is promoted. It's good for us to know. So we hold them to what they have signed. That they will partner with civil society to protect vulnerable and marginalized with disabilities. They have signed that they would, yes, stand for the United Nations Convention of the Rights of the Child and Human Rights laws. Our government has said they would take a leadership to make laws, policies, plans openly to include mental health issues, such as poverty reduction, education, women's health, infant health, disability, justice, social protection, and poverty reduction. Mental health involves effective leadership and governance for equity in poverty alleviation. I've been wondering and waiting for our leaders to reduce their salaries, to help the populace come to terms with it. You know, you lead by what? Example. That's evidence of mental health, when you self-actualize. So you say, look, because of the problems of subsidy removal and so on, I as a leader, I'm going to slash my salary by a third or a half. And that will be used to develop my society. That is power, brain, capital. A university professor earns a poverty wage. What's the difference? So effective leadership and governance for poverty, and you can imagine others. Number 2, comprehensive, integrated, responsive mental health, social care services in community-based settings. So there need to be integrated, yes. Service organizational changes, develop comprehensive community-based mental health and social care, promotion of self-care, provide responsive service to women and children living with domestic violence. Health workers must be trained to attend to both physical and mental health needs together. And of course, they must include mental health in primary curriculum, secondary, undergraduates, graduates curricula, and mental health in the workplace. We must collaborate with informal mental, this is part of the agenda we are promoting. Families, school teachers, religious leaders, NGOs, and of course, this forum. Number 3, implement strategies for promotion and prevention in mental health. Avoid being in institutions. Make sure early intervention. Services are community-based. Types of programs, you could have trauma interventions for people exposed to violence, early childhood programs. Make sure programs provide a safe, stable, nurturing relationship between parents and children. And of course, suicide prevention. And then finally, we need to keep information and feed back the information to change so that we can correct. This plan should have universal health coverage, life course approach, multi-sectoral approach, human rights approach, evidence approach, empowering persons with psychosocial disabilities. There's no health without mental health. Accelerating progress towards sustainable development goals. And all this shows the various no substance abuse and all the factors that will help us. Our nation's wealth is powered by our collective mental health. Preventive work among children. Children should be protected to promote peace. And they should have a voice. Research is very important, but then you need to have enabling environments for research. The government should provide enabling environments for researchers. As of now, most of the research funds come from third-party funds outside the country. And then, how do we deal with broken men and women frustrating progress? How can we have a school mental health in every school? Can research drive mental health programs? Does the school curriculum encourage thinking, innovation, creativity, and discovery? What sort of standard systems of testing can be carried out? Great nations enhance research. And there's this, finally, I just want to mention that the WHO also has guidelines on mental health at work. And there's this, talks about interventions, starting from universal that can be delivered at all workforce, manager training, worker training, individual training. Every worker in the workforce should be trained on mental health identification so that if one of the people at work is depressed or anxious or has social phobia, the leaders, the managers, line managers must know what mental health is. And they must be able to pick up mental health disorders and conditions simply. And of course, then we can have people who are at risk. If somebody has gone on maternity leave and had mental health, had depression, when they get pregnant again, the work system must realize that this person is at increased risk and must be protected. Or somebody who has an ongoing condition like HIV/AIDS, because we know now HIV/AIDS is like, it's well controlled on medication. And then indicated, that is, deliver this to, if you find somebody has emotional distress at work, we of course make sure they have access, not to a psychiatric hospital, but to something integrated within the healthcare delivery system. And then when people have been ill, they must be enhanced and facilitated to return back to work and ensure that they take their medication and see their doctors and therapists regularly. So we move from promotion to prevention to supporting workers with emotional distress or mental health conditions.
The event featured sessions on health and safety, with experts speaking on critical life-saving tips, occupational health management, and technological improvements in the sector. The focus on promoting mental health in Nigeria at the day one of the 15th edition of the PSRG-Richardson HSSE Forum underscores the need for Nigeria to maintain its mental wealth for national economic development.